I came across pharmacogenomics about 8 years ago. I was sitting in my college library on a spring day. I had just taken a genetics course last semester and was about to start pharmacy school that fall. Our genetics professor, Jay Whitner, had done an amazing job of delivering the course, and I wondered, wouldn't it be so cool to have a combination of genetics and pharmacy? So I Googled it, and there was the term pharmacogenomics. After a few clicks and short reads, I decided to borrow a book to library loan, and I read the first few chapters, and it made perfect sense. It was describing how the purpose of pharmacogenomics is to increase the likelihood of success with medication therapy by taking into account a patient's genetic variations. In pharmacy and modern medicine, when we discuss medication, we look at safety, efficacy, and also the cost. Both you and your doctor want to select a therapy that's going to give you the most benefit while experiencing the least amount of side effects. And throughout the years, we have achieved this by taking into account different factors, which will continue to be important, but pharmacogenomics has been a missing piece in this puzzle. Our DNA is basically coded information for how we look like and how our body functions. There are lots of enzymes and proteins that are coded by this DNA that work inside our body, and they have diverse functions. When it comes to medications, some of these enzymes help metabolize the medications or basically process the medications, and some other are the target site for medication action, where the medication does its job. And little differences in our DNA can change the structure or function of these enzymes and make us respond differently to these medications. And this can be true for the members of the same race or even same family. And this is the basics of pharmacogenomics. Genetics is a relatively new science. We discovered the helical structure of DNA in 1953. First pharmacogenomic studies were conducted in early 1980s. And the use of pharmacogenomics in cancer treatment is well accepted today. And while we might still be looking at the tip of the iceberg with the use of pharmacogenomics in other areas of medicine, we have enough information to act upon, to select treatment options that are safer and more effective based on a patient's individual genetic makeup. Here's some examples. Clopidogrel, a heart medication, up to 15% of the population at risk of treatment failure. But if we understand a patient's genetic variations, we can use safer alternatives or more effective alternatives. With codeine, up to 12% of the population at risk of toxicity. And on the other side, up to 6% won't receive any pain control. Again, we can understand a patient's genetic variation and use safer and more effective alternatives. With antidepressants, we can reduce the pain and suffering if we have an understanding of patient's genetic variations and select a treatment option first time around that's more likely to be effective and workable. There are challenges and barriers with the use of pharmacogenomics. Cost is more of a traditional challenge as it has been reduced to a few hundreds of dollars over the past several years. And because of this, we do see a more direct-to-consumer approach from testing companies, which can be a challenge because we still need trained professionals who can provide you an unbiased interpretation of the test results. Our testing options have also advanced over the years. We now have testing panels that include several genes and different variations for each of these genes. And we do still have some challenges with detecting less common variations in the population or knowing what to do about them. Also, when it comes to our professionals, physicians and pharmacists, a lot of them we have not received enough of formal training on this topic because it's a new and rapidly progressing field. So recently, I was on a 6-hour drive to Memphis to attend the Pharmacogenomics conference. And I thought this is so unreal that after that Google search 8 years ago, I've had so many opportunities to learn about and advocate for the use of pharmacogenomics. And I started to wonder this can be an accident. But before getting too excited, I recognize that this is probably just a filter bubble that I created with that naive Google search. Thank you all.